Yeah, so Lauren did show up in my office about 2 years ago, and he informed me that as a podiatrist, I do probably some of the most ABIs in my office, which are ankle brachial indexes, which is the first test that's done to screen for vascular disease. And I informed Lauren, he asked me why, and I said, well, I'm a diabetic, I'm Black, I'm female, and I'm a podiatrist. And I have family members who've lost limbs. I have an uncle who's lost limbs, a limb, probably will lose another one. I was diagnosed in medical school my second semester. I made it through to physiology. By the time I finished studying for my final, I realized I was in DKA. I was in about 500-600 blood sugars. Had to go on medical leave, go home for a month, learn how to be a diabetic, come back, take a final, fail the final, go to summer school, and pass summer school and go back in the regular training. So my entire medical career, I've been a diabetic. And living with the disease and taking care of patients with the disease and seeing end-stage disease every single day, and then seeing how this disease is preventable and all the different amputations, the complications that I see are preventable is what keeps me going, because every time I see a patient who's lost a limb or has a wound or something else is going on, I see myself. So my goal has always been to prevent the preventable. And that's exactly how I met up with Lauren. So the facts are there's about 180,000 PAD-related amputations annually, and 73,000 of those are patients with diabetes. Amputation rates among patients with CLI or critical limb ischemia is about 25%. So the prevalence of PAD in the U.S. varies from about 12 to 19.5 million. You know what year this was? So this number's probably higher now. So hospital costs represent the majority of PAD burden, which we all know working in the healthcare field. The cost from the initial admission, the person being seen by multiple specialists, the nurses, the testing, and all the different parts of being treated for vascular disease. It represents the majority of PAD burden. And the problem is growing. As you can see from this chart, it's just steadily growing. Back in 2006, a little over 1 million, and now in 2020, over 75,000 amputations. So I'm originally from Louisiana, so that's how when I went to the Amputation Prevention Summit, and he mentioned at the summit that they wanted to meet with the Congressional Black Caucus, I was like, oh, my cousin is the chairman of the Congressional Black Caucus, Congressman Cedric Richmond from Louisiana. And unfortunately, we're number 2 for amputations, right behind the great state of Mississippi. And Louisiana I think they just expanded their health care, Medicaid about 2 years ago. My mother's a nurse in Louisiana, so she likes to call and tell me about amputations. Matter of fact, I talked to her today, and she's like, oh yeah, I saw a lady, and they cut off one leg, and I told her she was diabetic, and she told me she wasn't. And now they're about to cut her other leg off. And she's still saying she's not diabetic. And it's unfortunate, these statistics, and it's scary, because I met, what was the doctor's name that came to Miami? Fuckeretti? Yeah, Fuckeretti. He's an interventional cardiologist in the Delta of Mississippi. And he actually flew to Cuba with me. And he was so passionate about the amputations in Mississippi that people were down there getting their legs amputated without any vascular studies. They would just walk in, see a gangrenous foot or an ulcerous foot, and just cut it off. no vascular studies whatsoever. And especially down in Mississippi, Louisiana, and the South, especially Mississippi, because they still haven't expanded Medicaid. So everyone doesn't get access to health care. And of course, we were just talking about the South. So what's the patient makeup? What's the racial disparity? So African Americans are 4 times more likely than any other group to get an amputation. So as you can see here on this chart, so African Americans are the highest for lower leg amputations as well as all leg amputations. So when I saw these alarming statistics, I wasn't aware that we were number 1. And I probably would assume that black men are number 1 on top of that. And when I talk to a lot of my patients, I get a lot of, from my patients, I don't claim it, I'm gonna pray it away, I'm gonna deny it. They go back to the Tuskegee experiment, or they talk about, you know, they just want money and I don't need these tests and I don't need these preventions. Or a lot of patients kind of feel like it's monopoly. It's a direct go to an amputation. It's a direct go to blindness. It's a direct go to dialysis, because this is what they saw in their own family members. So they could say, well, I'm just gonna drink my juice, I'm gonna eat my pies, I'm gonna do whatever I want. And I'm not doing that Splenda because it's gonna give me cancer. So I always tell them, if you keep eating sugar, you will not live long enough to get cancer. But they say, I'm gonna keep on using that natural sugar, honey, and everything else. So historically, from our history with healthcare, has made us a very untrustworthy group of people. And then with the racial disparities, when it comes to us as a population, you'll see cases where patients just say it wasn't even an option. They just walked in and said, we're gonna cut your leg off in about 2 hours. We're gonna get you pregnant. It wasn't even a discussion on alternatives so they wouldn't lose their legs. So also here you can see in African Americans, chronic hypertension is the highest. Diabetes is higher in the Hispanic community. And then African Americans are highest in chronic renal insufficiency, which are all comorbidities when it comes to peripheral arterial disease. And like I said, African Americans are 4 times more likely to have an amputation than Caucasian Americans, which we already discussed. So lots of times I talk to patients about statistical discrimination. And basically, the more you know, the more likely you are to survive in healthcare. If you have enough intelligence or knowledge to question a physician or say to a physician, I don't think this is right, or I want an alternative, or I want something else done for my family member, or if you're active in your care, you're more likely to get better care. And we actually would see this when I used to do nursing home care. For patients whose family members came routinely to see their family members, those patients were given better care because they knew their children were going to show up and ask questions about what kind of care their parents were getting. So PAD has a significant clinical, economic, human burden. So following an initial lower extremity amputation, 27% will have 1 or more re-amputated limbs within 1 year. 40% progress to a higher level of limb loss within a year of an initial toe, foot, or ankle amputation. 55% of those with PAD will get the other limb amputated within 2 to 3 years.
Yep.
So, as far as the thing I want to impart to all the healthcare people who do a general foot exam in your practice, a pretty foot is a healthy foot. So if you have your patient take their shoes and socks off, they have hair on their feet, their skin is pretty, their nails are clear, their feet are beautiful. I mean, beautiful feet. Because for a podiatrist, a nice set of feet gets us excited because we know that person is very healthy. But if you take their shoes and socks off and their skin is flaking off, their nails are super thick, they have no hair, their feet are cold, then you probably have a case of critical limb ischemia. So either you need to get them to me to do a vascular study, or you need to get them to your friendly vascular specialist. So that's the easiest way to determine if a person has good or poor good or poor blood flow. And also patients will tell you about the cramping. They have cramping at night, you know, the intermittent claudication, they may cramp walking 50 feet. Or they may mention, oh, I've been smoking for 40 years and I stopped last week. So, or I'm a smoker, my A1C is 12, I'm in renal failure, but I'm okay. But you look down at their feet, and on the top they're brown, and on the bottom their feet are black. So those are different things that you can just visually see and determine that this person needs immediate intervention. And then also like non-healing wounds, or actually I just saw a patient, she's on dialysis and she's covered in ulcers, and she's from head to toe. So I've been trying, actually I've sent her to a wound care clinic. They did a few things here and there, but she's still having problems, so she's actually gonna come back so we can work on all her wound care, for well, at least below the waist, try and control her wounds. But yeah, so the easiest way, and also I always tell my patients, this is like Sesame Street. If your feet do not match when you wake up, these are not like the other. Your feet should always be identical. One foot should be warm, and one foot shouldn't be cold. One foot shouldn't be swollen, and one foot should not be swollen. So in my practice, my patients are educated on signs and symptoms of infection. They're educated on new wounds. They're educated on, especially like ingrown toenails. In a diabetic, they can lose their toes behind that. They're educated not to soak their feet in any kind of, I don't know, liquid they find in their kitchen or basement or attic, or something their cousin who does hair told them to soak their feet in. They're advised to always take medical advice from medical people. So from their nurses, their doctors, their podiatrists, not family members who do tune-ups on their cars. And they're always, I mean, I'm very blunt with my patients. You know, I tell them, you know, home remedies can get you amputations. Do not do these things. Everything you need to do, if it's something, I always tell them, if there's something that concerns you or worries you, call me. And your magic words are always, I'm diabetic and I think something's infected. And we always tell them we either get you in that day, the next day, or we're gonna send you to an ER or urgent care. So the easiest way when you have a patient take their shoes and socks off, their feet are beautiful, they still need to see me, but if they look bad, they need to see me very quickly. Because generally, beauty in the skin of the foot, it tells the story. Beautiful feet are healthy feet, dry, crusty, hairless feet, or multicolored feet are problem feet. Thank you. Is there any questions? No? Okay, thank you.